Brian, you're not a doctor.
Really? Says who?
What's one thing?
Plays one on TV.
Right, and he stayed it all in. You're not a doctor. What's one thing you've learned from Dr. Weintraub that's totally changed how you see healthcare?
I mean, honestly, I'm more frightened of it now. I mean, I'm more, and I mean, this is kind of a negative, but like, I'm more frightened of it as a consumer. I think you kind of touched on earlier about like ignorance was bliss, and I was just like, good little robot, this is how it works. It's not my favorite. This is the pay, it does seem like it's very expensive, but I'm operating within the parameters of that because I don't have an understanding how not to. That I think this idea that these revelations about the billing, about it being coded, about that these things are designed to create a situation where I am paying more and more, or paying at a level that I shouldn't, that is not officially required in order to get the care like that. That's a big chunk to chew on. It definitely makes me think about my previous history, my previous medical experiences, and like how many times have I been taken advantage of economically when I really couldn't afford it. You talk about patients with their high deductibles not getting the care that they need because it costs too much. I'm one of those people. Like I've spent years not going because I didn't want to drop $2,000 on a procedure that I'm like, do I really need it? The recommended thing is to get a checkup every 2 years for this issue, and I'm like, well, maybe I can do it every 4 because that's
it's not bothering me now.
Right,
so why not?
right. But I was gambling on not having a problem, or not having a problem I wasn't aware of because I wasn't getting checked, and that I was rolling the dice that if it was instead of every year and I did it every 4 years, they aren't like, oh, well, you're 2 years into cancer that we could have caught if you come in. I mean, and
That's reality.
And the idea that could have been different potentially if I had been educated or chopped or taken some of these steps that you're talking about, even had the knowledge to even start that journey, I could have, been having much better health care, much better care of myself through my health insurance. Like, that's frustrating. I don't know. So I guess to answer your question, I'm kind of dismayed.
I think that's interesting because my next question actually will hopefully put a lighter spin on the concern. Ira, what gives you hope right now in healthcare? Are there any trends or innovations that you're excited about?
I think that healthcare, the actual delivery of healthcare and the quality of healthcare and the innovations in healthcare, they never stop. And I think that is on the patient side to receive the correct and best treatments possible. I think that is the thing that makes me always know that makes me feel like that part's going to be okay. Yeah. On the payment side, this is the paying field. We're talking about healthcare payments. For instance, you went to the hospital and you get a big bill and you have to pay the bill. If you went shopping and got a big bill, what do they give you at the end? They give you a receipt with every item on that receipt that you bought. And you wouldn't pay for something if you didn't get it.
Right.
And people don't know ahead of time that you went in the hospital. You can ask the hospital for an itemized statement of what happened to you and what you have done. Because I have people send me their itemized statements, friends, and they said they didn't do this, they didn't do that.
Yeah.
And so a consumer can educate themselves. And my first thing that I would recommend to anybody who went in the hospital is to get an itemized bill.
So are you saying if I got an itemized bill, which is obviously a request that first step to educate myself, and I see something on there that didn't happen, am I, as a consumer, empowered to contest that?
Absolutely.
See, I don't even know that.
Absolutely.
I didn't even know that.
I would.